Hi and welcome. I'm trying to learn medicine. Today, Achilles tendon rupture, and after we've done it, we're gonna do shoulder impingement training. And if you participate in the shoulder impingement training, then it's better at your own risk. Achilles tendon rupture. The Achilles tendon is the tendon which attaches the calf muscles of a leg to the back of the ankle. The back of the ankle. Now we're meaning the calf is this muscle, and the back of the ankle must be here. So that Achilles tendon is from here to here, from that muscle to the here. When a rupture occurs, it is always complete. The tendon snaps in two. So we're saying a rupture is in two. There are also other types of injuries to the Achilles tendon or other tendons, but a rupture, do we say, is completely. The symptoms of an Achilles tendon rupture: a sudden, severe pain at the back of the ankle, often as if it has been struck by a blow. A sudden, severe pain. So suddenly pain at the Achilles tendon there. Okay, also you can actually feel it. And severe pain, sudden and severe. Tenderness at the site of a rupture. Now, I don't understand the word tender or tenderness. I came across it today with something else. I don't get the word tenderness. I just don't really understand the word. Also the fork tender test. Maybe I should look up properly. And another symptom is an inability to stand on tiptoe with the affected. Yes, of course not. An inability to stand on tiptoe. So there are many different tendons at the foot. And the Achilles tendon, for example, if you can't stand on tiptoe, then the Achilles tendon is ruptured. Walking is possible, but only with a limp, and the patient will not be able to run. We're telling that here so in detail because there can be other types of injuries to the tendons, to other tendons, and then many things are still possible. If you have one of the side tendons ruptured, you can maybe still walk in one line that's directly frontal. That's why I'm telling that. And we're talking about a rupture. If there's an injury, just a partial tear of the Achilles tendon, then it can look maybe differently. So we're talking about a rupture. Now, walking is only with limping possible, and also running out. The duration. With treatment, a rupture will take from about 6 to 8 weeks to heal, so around 2 months. Causes. The rupture occurs most often in early middle age after some sudden activity. Sudden activity, that is interesting. Such as the first game of squash or tennis of the season. After some sudden activity, I don't think they mean after the football match or the tennis match. They're meaning after you had done the sprint. Or in the moment where you do it. Sudden activity, do we say, as causes? The Achilles tendon can rupture because of sudden activity. This is interesting. The treatment at home. None is advised. So to treat it at home is not advised. A rupture not, a complete rupture not, is not advised. When to consult the doctor? Immediately if a condition is suspended or the symptoms occur. Immediately the condition is suspected or symptoms occur. So they say, I didn't tell that at the beginning. So at the beginning. I didn't tell you that at the beginning. So we were talking about injuries and okay. And the other thing is, this is no medical advice here, I'm just reading what is in here. We're just learning. Now, we're saying you should consult immediately a doctor when you suspect it, or when these symptoms occur. So, a sudden severe pain at the back of the ankle, a tenderness at the site of a rupture, an inability to stand on tiptoe, and also not ability to run, and you probably shouldn't even try it. And also, walking is only with a limping possible. And also, don't do that. None is advised. No treatment at home, and consult immediately with a doctor if it is suspected. Or symptoms occur. What the doctor may do. He will send the patient to the nearest hospital emergency department. So, depending on what doctor you come to, you will get sent to a proper hospital. At the hospital, the lower leg may be x-rayed to make sure the symptoms are not the result of a fracture. So they're looking in, they're looking if the bone is properly, and that it's actually the tendon which had ripped and not the bone. If a rupture is diagnosed early, the lower leg will be immobilized in plaster for 6 to 8 weeks, and a shoe with a raised heel or heel set into the plaster will need to be worn for further 2 to 6 weeks. Now, because I very recently heard about plaster, and there are also alternatives, I want to look at a moment. I can find from when this book is. It is from 1983. Okay, so this book's actually a little bit older, actually. I don't think this was so far a problem, but I already annotated that to the thing for the last thing I can find it, because I can't remember the name. Achilles of Arcadia, where said that the cause is unknown. Now, and also prevention is possible to Achilles of Arcadia, so that the swallowing doesn't properly make the food going down through the esophagus, and that I wanted to go to that name also. The sphincter at the end of the esophagus is blocking and the food doesn't go properly into the stomach. That problem, here's written that the cause and prevention are unknown. This book's 40 years old, so maybe something has happened in the last 40 years. And to the other thing, I heard very recently that there are also alternative methods to plaster used, but they are also done in the hospital. They are maybe a little bit better. They're doing the fiber plastic or what it is, because they are lighter and they can be adjusted more precise. I think these were the main reasons. Okay, and now the completely lower leg is immobilized for 2 months, and also a shoe with a raised heel or heel set into the plaster will need to be worn for further 2 to 6 weeks. So for 2 months, the whole lower leg will be immobilized, so that nothing can be done. So that is why you should not run around and test around if your Achilles tendon is ruptured. You should not move it at all. And then also a raised heel can be worn. This is interesting. But I wanted to annotate again, this is 40 years old, and maybe there could be also done some research to this, because keeping the tendon for 2 months after these 2 months in immobilized position, the tendon shortened. I'm not sure if it's the best treatment for the Achilles to regain 100% strength. If diagnosis is delayed, treatment will depend on age. A young adult may have the snapped tendons sewn together, then a plaster applied. Okay. I don't really, with a little bit too fast information. Whatever, the tendon is sewed together and then plaster applied. Prevention. It is advised to avoid sudden, strenuous activity after a long period of only moderate exercise. So they're saying if you have for a long time just played a bit of football, a bit of running, you should not suddenly make a big football match and run a lot. And now interesting would be, and I actually would add it, I would say it could then also happen not just through too much stress, through one football match and suddenly, but also through a sudden run, just one sudden run. I would add it, I don't know if it's true, but it sounds logically to me. So, sudden stress, if it's now a very sudden run, or weightlifting, suddenly after a longer period of moderate exercising, intensive training. Outlook. If a condition is not treated, the separate parts of the tendon will unite spontaneously, actually, but in doing so will make the tendon longer. I want to see it on an X-ray or something else. The tendon comes together again? Okay, but it will be longer. This can leave the patient either with a limp or without a spring in his step, in his or her step. I don't know what a spring is. Whatever, it makes big problems if it's not properly treated. And also, if treatment is carried out early, the foot will return to normal in about 10 weeks, so around by now I think they said another 2 months, so around 3 months. Then it should return to at least almost normal. I don't know if 100%, but almost normal. If treatment is delayed, recovery takes longer. And I would also say not completely. Okay, Achilles tendon rupture. A sudden pain after a sudden run or a bit something at the heel, and also inability to stand on tiptoe and to run and limping, but you should not drive it out. You should consult directly a doctor, and then that whole thing is sewed together, immobilized, and after 2-3 months, it should then be ready again. And as I said, we all know, this is 40 years old, there are more things tested out than just letting it sit for 3 months and then, hey, it works again. It's more like there's this rule, this idea. Let's look again. Do as much as you can with the foot and do as little as you can do. Something like that. No, what it means is, if the foot can walk again, you should walk it. You cannot just take it for 3 months without moving anything and then it walks again. On the other hand, you should not walk if it's not together. And what I basically want to say is, don't just have your foot for 3 months immobilized and expect that it then works again. And the newer therapies, treatments are saying more like, if after 8 weeks you can start with small exercises, you cannot just keep the foot for months immobilized. That is very unhealthy for the whole foot. Now, what I basically want to say is, this is a bit shortened and a bit outdated. Don't just have your foot for 3 months immobilized and then walk again. You probably cannot just walk again. Consult your doctor and talk about it. There are better therapies to start to move the foot a bit earlier with professional exercises a bit earlier. That makes the recovery way more likely. It's not healthy to have a whole foot for months immobilized. But you should also not move it if it's injured. So you have to find the middle way. And it is also at your own risk, and don't take us as a medical advice. Now to the short impingement training. If you participate when it's at your own risk, if you're here for medical, whatever, you can go directly to the next part. We will do no short impingement training if you participate when it's at your own risk. Good and steady stand. And we're doing forward shoulder circuits. And another time. And now backwards. And now long arms, strong fists, and go as far back with the shoulders as you can. High up as possible. Front, down, and back. Up, and front, and down. And now the other way around. Up, back, down, front. Also, start as early as possible, but wait as long as necessary, but start as early as possible. Around that is the sentence. So if it's injured, you should not move it, but as soon as it is possible, you should move it. It's not good to have a foot paralyzed, immobilized for many months. Next exercise, and we don't have much time left. Next exercise, long and good arms, and we're going with the shoulders down, hand together, not only the arms to the inside. Now the arms to the outside, shoulders down, hand together. As short as possible, as long as necessary. Well, that is the sense of the idea. And again to the outside, shoulders down, down together. And one last exercise. No, not this one. Just the arms up, mid on the shrug. Lift the shoulders up. And down again. If this exercise causes pain, then don't do it. Again, the arms up. Shoulders up. And all down again. And again up. And down. And now stretching. One arm in front, the shoulders back, down, pull the arm in, have flat fingers, try to relax the arm, go with back with the shoulder, then the palm up to the sky. And the other. The shoulder is back, down, pull the arm in, have flat fingers, try to relax the arm, go back with the shoulder, then the palm up to the sky. And that was the shoulder management thing. I thank you very much, and until next time.